Well, I feel so excited about having a gavel here. I had to use it because it's 3 o'clock, and Commissioner Romano said I had to use it. So there we go. Calling this meeting to order, and we will start with the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Can I have a motion for the adoption of the agenda?
Romano adopts the agenda.
Support by Nard.
Is there any discussion? Can we have a vote? Thank you.
Barb, can you get a little closer to your mic?
All right.
Or move your mic closer to you?
The motion passes 12-0.
Thank you. Can we have a motion for approval of the minutes?
Motion to approve Van Sickle.
Support Wallace.
Is there any discussion? Can we have a vote, please? Thank you.
The motion passes 12-0.
Thank you. We will now go to public participation. The first opportunity for public participation is for those who wish to speak for a maximum of 3 minutes on any item which is on today's agenda. The second opportunity for public participation is for those who wish to speak on any issue. Is there anyone who wants to speak publicly at this time? Thank you. We will now go to presentations. Martha T. Berry, we will have Kevin Evans, the director. Kevin?
Chair, I'll make a motion to
sorry.
receive and file.
Thank you so much. Support, thank you.
Thank you, Madam Chair. Thank you, Commissioners. It was great to see you all again. My goodness. You're real people. I'm here today just to give you a brief update on what's happening. We recognize that as we have gone through just one of the most difficult times in history for many people, we have come through, and I am so proud of the work that we've done at Martha T. Berry. I'd like to share with you some of the things that have happened, and a brief update on the COVID, where our status is with vaccinations and visitations. I've got some fun information on a quality update, and then I do want to talk a little bit about the financial status, what our hopes are, and some information for you. But I also want to have that in perspective as to what's happened in the last year and a half. It's easy once we start moving forward to dial in on one thing that didn't go well and make that the thing, but that's truly not the case here. So I'd like to talk a little bit about that in the larger perspective. First, we're actually now up to 32% of our staff have been vaccinated and 83% of our residents. That goes along in line with what's happening nationwide, and there's a nationwide push for the vaccine resistance among healthcare workers. It's actually strongest among nurses and seniors across the country. Hospitals and long-term care assisted living has a reluctance to that. I will tell you this, though, to put your mind at ease at least a little bit. We have a combination of our staff between having been infected by it and come through it. They have antibodies, and that we have just about 68% of our staff are either vaccinated or have antibodies because they have contracted COVID-19. I know that sounds like an odd way to look at it, but it's important. If we remember when we were kids and the neighbors got chicken pox, what did the parents have you do? Go visit. Exactly. Well, because our systems really are some of the strongest ways to do that. That said, I'm fully vaccinated, and I absolutely advocate for it. And we still are working on that in the healthcare industry more than any other industry. We did have our first in-house vaccination clinic this last week, where our pharmacies are delivering it to us. So we're grateful for the work that we did in conjunction with the health department, who helped us bridge the gap from the initial push that we had. They helped get us vaccinations in our facility and coordinate with some of our residents that came in the building, whether we're unvaccinated, we were able to get them over to the health department, or have vaccines come on site to get that taken care of. So we're grateful for that. That was a short but important bridge that we had with them. Visitations, I'm pleased to say we're pretty much business as usual, except in our facility, we still require masks. So anytime you're in a resident area, any visitor, any vendor, and any staff member still is required to wear a mask. That is from the CDC requirements. Also, the World Health Organization is also recommending that. We believe it's the right thing to do. There's a couple of items in that, even though there is herd immunity with our residents and pretty close to that with our staff. We also believe in something called psychological safety. There's something to be said for saying, hey, I'm with you on this, and I just want to do a little bit more. So we wear them, and I still have them, and I have lots of them. Also, I have lots of them because the county helped us with that too. So we have a whole room full of these to be able to share. We were the only facility that I'm aware of in the county and maybe the state, I keep asking, that gave family packs. The biggest risk to residents are not in the facility, but in the community. So we were giving family packs to our staff during that time so they could take home hand sanitizers and masks to be able to keep themselves safe when they're out in community. And I believe that was the reason why after July of 2020, the only illnesses that we had of COVID-19 or our residents came from people with whom we admitted. So I'm really proud of the work that our team did there. So families can still visit. Now here's an interesting thing. If the resident wants them to drop their mask, they can do that, and if they're fully vaccinated. So there's some risks that we're taking still by bringing people in, but we believe that the risk to the resident is far outweighed by the need to hug their grandkids. So we're keeping an eye on anybody that has that. If we see any kind of signs or symptoms, we're still monitoring for that. But you can be awfully proud of the team there. It's a privilege to work with them. Our quality system, we talked a little bit about the 5-star system, and this is a slide from what I shared a couple of months ago, and those cut points have not changed, but as of the last meeting, I let you know we're 2-star, and we're hoping to get to a 3-star pretty soon. As of July 1st, we are now a 3-star facility. So that has to do with our improvements in our survey, our preparedness, and we'll have another survey that'll be put on this year that I believe will keep us strong there for this year, and our goal is to be 4-star next year. So we've moved from a 1-star facility, 1-star quality measures, 1-star overall, to 3-star overall, 2-star health, and 2-star with our quality measures, and we're going to keep going there. So I'm very proud of the work that we've done there, but we're not done. As far as money goes, we've talked before about the other post-employment benefits. And one of the challenges that we had here is there were a lot of decisions that were made during good times that the county had for decades, that when it went bad, it really put it put the county as a whole at risk. And what they did was they changed how they managed the OPEB from pay-as-you-go to having it bond sold to be able to smooth out the funding on that. Now, that was great for the county, but it had the unintended negative consequence of hurting us financially. So a couple of years ago, before all this started, we talked about that pinch point that we had there, and this commission was just really gracious in voting in a small millage to help us with some expansion of services that we were regulatorily required to do. We spent a lot of time talking about that, didn't we? Almost a year. So that was helpful to us. So the county just refinanced the OPEB, but when that happened, unbeknownst to us, there was a $1.5 million additional debt put on Martha T. Berry. And I don't understand what's happening there. I know actuaries can be kind of an unusual thing, so I don't know how that occurred. I did talk to the county executive office on that, and I'm supposed to get a call from the finance department. Again, I'm not expecting ill will on that. It was just, that was a surprise to us that we had that. The good news on that is it's $25,000 less annually, but I would have expected, because of our turnover, for that to be significantly better for us. As a matter of fact, Chairman Brown, we talked about refinancing that originally as a way of helping us with, and they said at the time it couldn't be done. They found a way, which I'm glad for the county, but it didn't help us as much as I had expected to. And I'll get the answers on that and share that with you at a future meeting. I also want to let you know that, that's a negative thing, but the positive is with the American Recovery Act dollars that we received over $6 million from the county to help us with hero pay and things like that. The governor had required some hero pay things to happen, and since the county got the money specifically, I couldn't go to the county and to the state. I had to choose one or the other, and the county really worked with us beautifully on that in providing. So we've been, any COVID-related expenses, like the screens that you see here, those kinds of things we were required to do. We were required to have more regulatory compliance and auditing. We had to buy hundreds of thousands of dollars in test kits. So all of those, we worked out a good process with Office of Emergency Management to get that for us. So I'm really pleased about that, but that well is running dry. Okay. So, with that comes, we've been didn't have the ability to have vendors come in, contractors, to fix things. So our team was putting things together as much as they could. And then I did share at the last meeting that I was hoping to be able to get some things repaired through the new money coming in. The county's received $172 million, 86 this year and 86 next year. And then there's also in the works some infrastructure money that's coming that's right now still in Congress at a federal level that they haven't determined what that amount is. I was hoping we will have some of that for Martha T. Berry. I was informed by the county executive's office that they do not have any intent of helping us with that. Again, so in context of what we talked about before, let's keep it in context of all the stuff that we have worked on together. I am in no different position than before they had this $172 million, right? So it's not their fault, right? That's where we are. And this is a big county, so I do not begrudge them that. I just need to know that there's some things that we have to get done. And I'll be looking at, right now, we're required to upgrade our HVAC system, which is about, I think, 25 years old. CDC is recommending scrubbers, and CMS is saying that will be coming as a formal recommendation for infection prevention. Right now, I don't have the money for that, so we'll be talking about that at future meetings. All right, so I just want you to be aware of that, and that was my 6 minutes.
Commissioner Romano?
Thank you, Chair. Hi, Kev.
Hello.
Just a couple, you mentioned you did the repairs that you're talking about. Did you put a number on it? Did you put your head around? You give me a ballpark? What are we talking about?
Yeah, I submitted a letter to Commissioner Chair Brown and the Executive Office, Mark Hackle, at the same time. And it's and this is the top 10 most important items is what we have. We have got a lot of things that we're going to be doing through our normal budget, but these are things that are just a little bit different that we have to have. The total amount is roughly $13 million, but we're looking at that over 10 years. What I'm looking at right now that has to get done is roughly $3 million. And that's roughly 1.7 for the rooftop units, because we need scrubbers, we need negative air pressure. I don't know, I'm sorry, there's many of you that I don't know, so I don't know if I'm sharing things that you aren't aware of, so please ask me. I sometimes speak in medicalese, so forgive me. So negative airflow rooms are required for certain biologic containment. And we don't have that. We don't have any air scrubbers. We use HEPA filters. HEPA filters didn't exist when our systems actually first were put in place. So if you think about the purpose of a filter and what drives them, we're actually taxing our motors because these things it takes a lot more work to draw air through them. So that's what we're putting in there, and we're repairing more and more. We have our P-TACs, which are the units that are in every single room. Those, they don't make them anymore, and the compressors that we have that use the old Freon, it requires a custom refit. So right now, we're cannibalizing our dining rooms, taking parts, because we have like 8 or 10 of them in some of the dining rooms, so we're taking every other one out and using them for parts for the rest of the facility, for the residence room specifically. So that has a pretty significant cost to it, to about $1.3 million if we get it all done. So those are the two things, I believe those are the two big things. The third one that I really would like to do pretty quickly are the boilers, which are almost 60 years old. They're externals. We've had to patch the external side of them because they are rusting after 60 years of use, 24/7. And those are under pressure. So we're paying very, very close attention to those. And that's a big job. But so we're hoping to get any help on any of those. The good news is for us that at the end of 2022, we'll be done with our building use agreement. And at that point, we can renegotiate that. That, I think, was due to pay off an improvement that was done 20 years ago. Commissioner Brown, you may remember when they added the front of the house there, they put a bond for that, and we're essentially paying for that through the building use agreement. We have a payment this year and next year. Then after that, that'll be about $1.2 million freed up. And my goal is to use a portion of that for what most people would understand as a sinking fund. Our language is we fund depreciation. That's an allowable expense under our cost reporting system, which is very different than the county's. But it allows us to put money in specifically and only for fittings, fixtures, and facility. And when you do that, then we can be a lot more self-sufficient. So that 1.2 isn't going to be just, just folded into wages. We want to make sure that the building is there and there for a long time. So that funded depreciation account we want to build up, because eventually we're going to need, new roofs. We're going to need new lots of things. So we'll be doing that with that money.
That's a long question for a short answer. Okay.
My apologies,
No,
Commissioner.
please don't. Here's what bothers me a little bit, Kev. This $1.3 million that they found when they did the, was it a refinance, or they did an audit? What did they do?
1.5, yeah, they did a refinance, yeah.
Okay, so they found this money. You came to us before and said, hey, this millage, if we can get this millage, it could really get us squared away. Where was this $1.3 million that you weren't aware of? And I'm not blaming you, I'm just asking because.
It's not that they found money for us, it's they added debt to us.
That's what I'm saying. So why weren't you aware of this debt? Because this first time I've heard.
Well, I heard about it last week because what happened was we had an external auditor, and I spent several $1,000s because we were not in balance with what the county said we had indebted and what our books had. So we went and thought maybe we had a journal adjustment that was wrong, we had something in the wrong year, because 1.5 is a lot of money. You usually can find it pretty simply. It was just a coding error someplace. So our auditors, when they were looking, we couldn't find it. We paid our auditors to look for it. They couldn't find it. We got with the county, and that's when we had this table that was the amortization schedule for the OPEB that did not agree with our current one because they had refinanced, and I was not aware that they refinanced it.
So your amortization schedule didn't coincide with what?
That's correct. They sent us an updated one. Now it does, but.
Well, isn't that, again, please appreciate that, I'm not asking, I'm not questioning you. So isn't your amortization schedule that's set off for what, 10 years, 20 years?
Yeah,
I mean, when you originally get it, it's just a matter of crossing out lines to know what your balance is.
Right, but they refinanced it, and when they did that.
Well, when they refinanced it, that's when the court came in.
But more debt came in, and I don't understand how that came in, but it could be a number of things.
I got it.
When they
I know.
refied it, it could be that they recognized that there was more expense than they had originally, and they might have baked that back into it. I don't know. It's counterintuitive to me, as are most actuarial tables, so I'm not going to imply bad will in that. Just communication hiccup because, well, it's COVID.
Well, and just for the sake of the
I'll
new
give them a better-
commissioners, I'm sorry, I didn't mean to interrupt you.
That's
Go
okay.
ahead. Oh,
I'm
for the
giving you
sake
the
of
benefit of the doubt,
Okay,
yeah.
for the sake of the new commissioners, when that millage was approved, again, I'm just stating a fact. We were unaware of all these repairs that need to be done. You're talking like $13 million. You're talking about spreading it over 10 years, but it was never brought up before when you were asking for the millage. This is
because the
something that
millage-
just jumped at you.
Right, no, Commissioner, you're absolutely correct. I did not share those with you because at the time, we were focused on, that was a long-term plan, but the millage specifically was to handle the pinch point of an expanded service that was regulatorily required. The only time that the county commissioners can put a .1 mil millage on behalf of our facility is if there's a regulatory change that requires us to change, or an expansion of services. For example, if you wanted to serve the indigent with an assisted living here, you could put a .1 mil millage in there for expansion of services. But I can't just come and randomly ask you, hey, I'd like to fix the elevator.
Got it.
Can you give me a millage on that? That's not the intent of it.
Thank you.
Is that helpful?
Appreciate it so much. Thank you, Chair. I got it. Thanks, Kev. Sorry it took so long.
Commissioner Song?
Thank you, Chair. Hi, nice to finally meet you in person.
Pleasure's mine.
Do you think we could get a copy of that audit report, just so I'm trying to understand more about that 1.5 million?
Sure. Yes, let me get that for you.
Okay.
Yeah, I'll get that for you.
All
I'm trying to
right.
figure out the best way to have it because it's a little clunky. You'd have to take a look at the 2019 actuarial table versus the 2020 and do the math. But it's a number of emails that went back and forth between our auditor.
Okay.
And but I can get a summary of it for you.
Absolutely, that would help us
Sure.
tremendously,
Happy to do that.
since some of us are new here. And then you said 31% of your staff is vaccinated. The governor just announced a new lottery, $1 million lottery. Do you think they would be, take advantage of that, be interested?
Madam Commissioner, I might get revaxxed.
Right, absolutely. I know, I was waiting for her to make that announcement, because Ohio did it a few months ago, and it seems like that's sort of the trend. So I just wonder if that's something that you will bring back to your staff to encourage them to get vaccinated.
Oh, yes, we do personal emails. We have an interfacility TV station that we've put those messages from the CDC, from the lieutenant governor, from the governor's office. We're marketing it pretty significantly. At the same time, the regulatory risk, if I demand it, is that I'm personally liable of anything that happens, and that's a very scary thing.
Absolutely, I
Also-
understand.
Also, we have to, I'll just be direct with you. I believe it's the right choice for me. And for me to say that you have to do that is difficult for me to do, all right? Now, there's precedent for that, isn't there? We already have flu vaccines and, but those are all, people can all choose to have that or not. And in some hospitals, they require it. But as a government entity, we have specific challenges for us that were just recently cleared by the CDC that said, no, you can make it. But prior to that, a government entity couldn't do it, so.
I'm only concerned because, they're working with such a vulnerable community, and so, I guess you would think that they would take that into consideration, because they're putting, your residents at risk.
Sure. If I could put your mind at ease just a little bit, our source control is outstanding. We do weekly screenings, and we still require testing of all of our staff that are unvaccinated every week. Those that are unvaccinated do not have to be, and we're very aggressive with that list. If they don't test, they don't work. We do that to keep our residents safe. We also have great source control. We have sanitation stations all over the building. We give them any PPE they want. If they want to dress up like the Michelin Man every day, they can do that, right? Because we have it for them, right? And we have some that continue to wear face shields and gloves and gowns. About 4 of them do because they've lost family, right? And I want them to feel safe. And they're still doing the work. I just want you to know that. So yeah, but we do require that source control, which means at the face. It's to protect the residents. That's what the masks are for. It's not to protect the staff member, right? So we do that. Also, if you take a look at the spread of it now, you look at the biggest risk is not in our facility, but it's in community. And we're under 2% for several weeks now. And so I'm pleased with that. The Delta variant's coming, and those that have had the vaccination fare better than those that don't. So we're using that as another, just a point of information for them to communicate. But we'll continue doing that.
Thank you, Kevin. Commissioner, are you finished now?
I am, thank you.
Very much. Commissioner Farrington?
Thank you very much, Madam Chair. Kevin, welcome. I guess I want to dive a little bit into the supposed audit. What firm was used?
We used Manor Custerson.
Yep. Now, you said they didn't find the error. Who did?
Oh, they communicated with the county finance department. When they couldn't find it in our own books, they started communicating and saying, where do you see it? With the finance.
Was it an actual audit, or you just asked the accountants to come in and find it? Because based upon the answer you gave to Commissioner Song, it's not an actual audit.
Well, we were having our audit done at the time.
Oh, so
Right,
you're in the middle of the audit.
So we were in the middle of the
Part of
audit,
that
and
function.
we had added cost to it because we couldn't find this, and they needed to do additional work outside the scope.
Excellent. Excellent. Thank
Yes.
you.
And sorry, Madam Chair, that's why I only give a short presentation, because I have long answers.
No, it's fine, thank you. Commissioner Hall?
Thank you, Madam Chair. Kevin, two things. This morning, we had our actuarial report on all the retirements throughout the county, and I'm happy to report Martha T-Berry is plus 100% funded.
Yes.
So that's a rarity anywhere in this country. So congratulations on that. Secondly, I keep hearing the word error. When you send this audit report, I would like to see a complete explanation from finance of what they considered this to be and how it transpired without your knowledge or awareness. So we have both things, the audit report, and if you want to put your explanation in there as well, that's fine. And then we have theirs. So we have a complete story when we're looking at it. That's all I have, Madam Chair.
Thank you. Commissioner Nard?
Actually, I withdrew, but I do want to ask, because Commissioner Hall just asked what I was going to ask you. But have you thought about, with the new variant, of what you may need going forward?
That's a great question. Thank you, Commissioner, for that. We are well prepared for the next pandemic. Our emergency preparedness plan already has a flexible isolation area. We don't have the negative airflow, which is one of the requirements when you have something like this, but we actually know how to build ante-rooms between areas for donning and doffing PPE and disposing of it properly in biohazard suits. We have additional infection prevention systems all around. And if you did a tour, you would find that right now we have 5 months of PPE. Yeah. So, yeah, and I could go on, but I know you actually have more to do than just my agenda. But it's very different than when I thought it was a low priority, when we were looking at all the lists of all of the emergency preparedness things we had to plan for, fire, flood, human issues. I had pandemic as the lowest.
Commissioner Song, did you have another question?
No.
Thank you. I think we can go for a vote now.
Madam Chair, did we ever have a motion to receive and file?
Yes.
Kevin, you want to see us for another year now, right?
It is great to see you. It's great to be here.
Thank you, Kevin, so much.
The motion passes 12-0.
Thank you, everyone. Good day.
We will now go to 7A, Macomb Action. Ernest?
Hello, Commissioners. Good to see you in person
Hi,
finally.
Ernest. Yes.
This is a pretty straightforward item related to the Family Resource Center on 196 North Rose. Traditionally, we had contracted through Mount Clemens Community Schools to do custodial maintenance and repair on the building. Due to the current labor shortage, they have communicated to us that they have no stable capacity to provide custodial or maintenance and repair. So we are moving the funds that we usually expend through the district, through their contract janitorial, maintenance and repair, to come over to the county facilities and operations team. They've already started custodial, and this budget will allow them to cover our annual expected maintenance, repair, and custodial costs.
Chair, I'm sorry, can I please make a motion to receive and file?
Yes, thank you.
You're welcome.
Support Nard.
I always mean to start it, and I had my finger on it to do it again.
Is it to
and,
move to full
Thank you
board?
very much.
Okay, motion to move to full board.
Support.
I just lost my spot. Oh, now no, I'm leaving the meeting.
Motion to make a budget amendment.
Yes. There we go. Can we have a vote on this?
We have a.
Oh, I'm
Chair
sorry,
Brown
I didn't
also.
see that. Chair Brown?
Ernest, good to see you.
Yeah.
You're looking well. It hasn't changed much since the last time we saw you.
Hopefully, I'll have more exciting items to talk with you about next time.
Well, since we're on the subject of the budget and since you're here, I got a question about grant funding available for other areas, like the homeless, McCrest is a homeless center. Do you have any interactions with that facility at all? Do you have any programmatic ties to that center down the street? They just put in a new building, they raised about $1 million.
Yes.
To build that in there. Can you,
Yeah.
with the leave of the chair, since he's here, may I ask him that question?
Yes, of
Thank you.
course.
Yeah,
Absolutely. One of the main structures that we encounter McCrest through is a continuum of care structure. That's the mandated homeless coordinating body for the region. So we have been enthusiastically supporting McCrest in their new facility build. We are also helping them coordinate other federal and state funds to explore additional expansion. There's a property next to one of their current properties. We're exploring the use of CDBG fund as well as CDBG coronavirus additional funds. So we are both programmatically working with them and interacting with how they reach out to homeless residents, how they coordinate intake and entry of homeless residents, and how they both do homeless prevention and rapid rehousing. So programmatically, we work with them a lot, and with all of this funding coming down the pike, especially a lot of the coronavirus-related funding, we are working with them actively to find some additional dollars.
thank you. I don't know if you're aware of it. If not, this will be the first time for you, but they're looking for some money they need some infrastructure dollars to help them with a connection to the local lines out here in front of the street. Not a lot of money, but they need some help. And we might want to reach out to them and
Absolutely.
speak to them, and then you and I can have a conversation offline about what, if anything, this board can do to support that. And you have many keys to many pots of money, and perhaps there's something for infrastructure that they could take advantage of to help them bridge that gap. Literally, it is a bridge because it's across the
Absolutely.
street.
One of the mazes we're navigating here is what's dedicated for programmatic dollars, service delivery dollars, capital
As we all
outlays.
are.
So yes, we will find that out. Thank you very much.
I appreciate, thank you, Ernest. Thank you, Madam Chairman, for giving me leeway.
Thank you. I believe we can go to a vote now.
The motion passes 12-0.
Thank you.
Thank you.
Thank you, Ernest. We are now going to 7C. I need a full board approval, please, for, wait a minute.
Chair, I think
No,
we're on B.
sorry, we're going to be Area on Aging, Jim McGuire and Maggie Olet.
Motion to move to full board.
Motion to
Support,
full board,
Farrington.
please. Thank you.
Thank you. My name is Jim McGuire. I'm Director of Research, Policy Development, and Advocacy with the Area Agency on Aging 1B. And with me is my colleague, Margaret Olet, who is the Director of our Clinical Services We're here to present for your support for our annual implementation plan for how we utilize the state and federal funds that we're going to allocate to support home and community-based services across our region. Maggie is responsible for all of the services in the plan, Meals on Wheels, in-home services, care, adult daycare, and so forth. And she's not new to our agency, but she's new to that position, so we wanted you all to meet her.
Pleased to meet you. Thank you for allowing us to present today.
And I know that there are some new commissioners on this board that aren't familiar with us, so let me just take a minute to step back. We're a nonprofit organization, as an area agency on aging. We are selected by the state to serve as the area agency on aging for a 6-county region in southeast Michigan. There are 620 area agencies throughout the nation. They're created by a federal act under the Older Americans Act, and there are we have 16 colleagues in the state of Michigan that cover the entire geography. Our geographic region is the 6 counties that surround Wayne County, so we have everything from Port Huron through Macomb, Oakland, Livingston, Washtenaw, and Monroe counties. We have about 30% of the state senior population in our region, and we're probably about the 15th largest area agency in the nation based on population. And our main responsibility, we're a planning organization. We are receiving the state and federal funds that are allocated to support home and community-based services in our region. Our job is to assess the needs of older adults and then use our dollars to provide the funding to and select organizations through our request for proposal process to provide the funds. So we're the funding source for many programs from Macomb Community Action. Actually, the contract we have with MCA for the senior nutrition program is actually the largest contract that we have, the largest contract between an area agency on aging and a provider in the state of Michigan. To give you just a little bit of perspective on that. And as part of our process, we have to develop a plan that shows how we're going to allocate our dollars to which services and what amounts throughout our region. And we have a board approval process, and then we share the plan with each of our 6 county board of commissioners, which is what we're here to do today, to provide you with an opportunity to provide feedback and show your support for the plan or challenge elements if you want it, if there are things that you want to discuss. And then once we have county board approval, that goes up to the state for the state's final approval of our plan. It's a process that's required in order to receive the dollars coming in to our region. I'd like to make a few comments in the plan. When we look at all of the agencies that we fund and what we do ourselves as an agency, we touch the lives of about 23,000 Macomb County seniors in a given day between Meals on Wheels, calls to our call center, and so forth. In terms of funding, we, in this plan, provides for about $5.5 million of the funds that we receive from the state are allocated for Macomb County programs and services and contractors and the services that we provide for the county. Part of our process is to hold a public hearing on the plan so that before the plan comes to you, we've asked our stakeholders and seniors in the community to review and comment on what we're proposing to do with the dollars. That was held. We had 41 participants there. Commissioner Brown, actually, we had a technical difficulty, but we finally did get your videotape to be a part of the record for that plan as well. And so we took into consideration the comments at the public hearing for this plan. Essentially, the plan is 98% maintenance of effort. When people talk to us at a hearing, they support the work that we're done, that the mix of services that we allocate our dollars for seems to be the right mix. There are some suggestions that came up from the hearing that caused us to make some changes in our plans. We had a greater focus on the recognition that it's not the area agency that serves most of those 23,000 people. It's the people like Macomb Community Action, Department of Senior Citizen Services, Catholic Social Services, that are the ones that touch the lives. And so greater recognition of that was provided. And then also there was a number of discussions about the need for flexibility, greater flexibility in the contracts that we have for service providers and how they can provide those services. The state sets a standard for what is considered chore service, what is considered a meal on wheel, that we actually approve all the menus for what's to be provided in the nutrition program. So, but we found in COVID that things got real different, and we needed to be able to have a lot more flexibility in terms of how we administer those programs and what we're allowed to do. For example, in one of our programs where we assess people's needs for in-home services like personal care, homemaking, and respite, we required to do an in-person assessment, 6-month reassessment in person. Well, in the COVID, we got flexibility from the state and the federal government to do some of that virtually. And we found that we didn't find fraud or abuse or misspending of dollars, and people were getting the services they need. So at this time, and that was the main discussion at our public hearing, was we're going to sit down and go through all of our service providers with our provider network as stakeholders and re-examine what's in those standards and determine where we need to have greater flexibility for the providers to meet the needs of the people that come to their doors to receive the services. Let's check my notes. The other interesting part of the plan, I thought, was our COVID response. The state requires us to sort of tell them what we do, and just some interesting facts from the COVID response that we led with our providers network. We collaborated. I think that we've just done this with the Macomb County Health Department. We collaborate with our health department just recently to send a mailing to every single home that we can get through a mailing list of seniors in Macomb County with a message from the Public Health Department and the Area Agency on Aging, encouraging them to get vaccinated. We use some of our federal COVID dollars that the state passed through to us for that particular project. We were very active in addressing the need for food, particularly in the early days of the COVID. We've delivered over 15,000 quarantine boxes, which are boxes of dry good foods that serve 21 different meals. And a shout out, if anybody, I don't know who's covers St. Clair Shores, but we really are indebted to Joan of Arc Church in St. Clair Shores that allowed us to use their vacant schoolrooms to be the the distribution point and the storage point for that thing. So thank you, St. Joan of Arc. We also got boxes of fresh produce when one of our produce companies got a federal grant to get fresh fruits and vegetables delivered to seniors. I think in total we delivered 364,000 pounds of food. We were very aggressive at going after collecting PPE information and devices and face masks and so forth to made them available on an almost unlimited basis to our provider network so that they could protect their staff and their delivery of their services. And then one of the other interesting things we did was, some of you may sell this in the media coverage, thinking of Kevin here, we also took a stab at addressing some of the severe social isolation in facilities like nursing homes and assisted living facilities, where we used some of our federal COVID dollars to purchase devices to address social isolation for the residents to the nursing homes that wanted to be a part of this project. I think we funded 30 devices. 30 nursing homes asked to participate in this across our region. So we provided the famous robotic pets that the news really picked up in terms of the display, that provides companionship and encourages conversations about between residents and staff and other residents. We provided comfort dolls, which are dolls and the comfort dolls are particularly designed, excuse me for speaking too fast, designed for residents who have some level of dementia or mild cognitive impairment, because they really take to them, and these dolls, for the right people, it triggers a very strong emotional response. They hug them, they kiss them, they sleep with them at night like they were a baby. And the staff of the facilities observe the behavior of the residents, note very clearly the improvements in joy, smiles, less behavioral issues, and so forth. We also provided Echo Show devices, which are video conferencing type devices that we did this in a partnership with Amazon and some of our assisted living facilities, so that residents who were quarantined could have visual contact with their families and loved ones. And we've got a long big grant, I'm telling you too much about this. But so that was another initiative that we were very proud of, and it really seems to make a difference. I'm the researcher and the evaluator. When we measured the level of loneliness before the people got these devices and the level of loneliness they report after receiving them for the first 30 days, there's a big difference in a positive way in what they report as loneliness and social isolation. And we know that that's one of the social determinants of health and has relationships to health status and health utilization. Sorry, I think I called a little bit of Kevin when I got up here. In terms of the changes of the plan, the other thing that we're going to have a really strong focus is on serving family caregivers and supporting family caregivers in their ability to sustain their caregiving abilities, so people don't necessarily have to come to us or have to come to nursing home facilities to provide the care of their loved ones. And the longer that we can help them sustain their caregiving energies and be successful competent caregivers, the better we're all off for that. We're also going to be very aggressive at pursuing grant opportunities and fundraising opportunities to bring in alternative sources of non-public revenues to support the services that go to our programs. And we have a careful focus on diversity, equity, and inclusion to make sure that our services are available to all populations, equal access. You know that the county is very diverse in terms of its populations and subpopulations. And so we're going to take a more careful look at how accessible is our services. Do we have things that need to be translated in other languages? Are we geographically spreading the services out so that the rural area, people in rural areas have just as much access as in the lower, more densely populated areas? So that DEE is a state mandate, and we're going to look at that in terms of assessing how we're performing as well as training for our providers and our staff. I think that those are the key changes in the plan and the differences. I'll open up to questions and comments.
Thank you very much. Commissioner Matusek, please.
Thank you very much for the presentation. As your representative on this board, we went through this plan with a fine-tooth comb at our meeting last Friday. You will note, if you go through the many pages here, that our Community Services Department did make comments and submitted letters during the public hearing part. I raised some concerns on Friday. We've since had multiple conversations addressing those concerns. Ernest had raised some concerns about particularly the home injury prevention program and reimbursement for units of service. And we think we now have some clarification on that. That eases people's concerns, eases Ernest's concerns. So I just wanted to speak in favor of this resolution and their responsiveness to the concerns that we've raised. So thank you.
Thank you, Commissioner. Commissioner Nard, please.
Thanks again for the presentation. I just wanted to commend you. Two of my daughters, they're home care workers, and a lot of their clients are with the area on the agency. And I just want to just commend you on the awesome job that you did during COVID. They both worked through COVID, and the residents were really happy that they were able to stay in their homes because of your programs that you have that was for the homebound clients. So I just wanted to commend you on that. You guys did an awesome job, and I'm very much in support of the resolution that's going forth today.
Thank you. We're an advocacy organization. That's part of our federal mandate. And one of the issues that's been important is that direct care worker $2 an hour wage increase. And please report that the House and the Senate, working on the budget, still have that in for fiscal year 2022. So your daughters should be happy, and should be it should be a happier Christmas time for you if they keep that way too. I'm just kidding.
Thank you. Commissioner Farrington.
Thank you, Madam Chairman. And I guess some of this is my being naive and exactly some things you do. So part of, I'm going through the PSA description, part of what you do is advocacy for not just home health care, but also the buildings, the long-term facilities, correct?
Yeah.
And I appreciate the advocacy for the people working there. They most definitely deserve the increase. And I've told my legislator that. But I guess I have a little other concern. I'm going through the description of your services, and it says, number 2 about advocating for social needs. Number 3, advocating for issues of concern. This state let down our senior population in those facilities. Were you advocating for them at that time? Because it has been horrible what we did to our seniors over the last 15 months.
I'm sorry, I missed the first part of your question that we advocated for.
My understanding is that you are to advocate for seniors in a wide variety, one of them being the healthcare facilities, the long-term care facility buildings, those residents. I want to know what you guys did to advocate for our senior citizens who are basically stuck in jail for 15 months.
Well, we happen to operate the nursing home ombudsman program, where they used to be sort of the nursing home watchdogs, and they're there to receive complaints and do complaint resolution between family members and residents. That was our primary role in terms of working with the nursing home industry throughout this process. And that's really why the program I described about addressing social isolation, because what they were telling me during the pandemic was the biggest problem they were seeing that families were coming to them advocating for their loved ones in the nursing homes was this quarantine and the inability to communicate. So that kind of became our priority, and we did
Or changing a policy perhaps that only a couple states in the entire country had? I mean, seriously, I mean, I wasn't even on this board prior to January, and I heard it weekly from people just crying and breaking down about how they couldn't see their parents, or their parents were going mentally ill because they hadn't seen anyone. And if this is your main function, I can't support this if you didn't do it over the last 15 months. And I'm sorry, this is something very close to me. And I'm trying to figure out, did you not advocate hard enough, or did someone not listen to you? Because we all know the problem was there. I mean, it's gotten plenty of publicity.
I'm not aware. Did you want to speak?
No, so the only thing I can say is that from an advocacy standpoint, from the AAA 1B, we do administer the long-term care ombudsman program. That was a community-based agency, but the community-based agency that was doing it could no longer, or chose not to support that program, and so it was important enough to us to take it in-house, and we didn't let that funding go. We took the long-term care ombudsman program in-house from AAA 1B that was once a community-based agency supported, that we funded.
Yeah. But I think to your question about the policies, it was not clear.
It says avocation, so I'm thinking you're going to the reps, the senators, the governor, and advocating on the behalf of the senior citizens.
I think at the time, it was not clear from our analysis what was the available solution to solve and reduce the risk.
All right, thank you.
It was debated. And I'll tell you, my mother just died in a Macomb County nursing home, so I have that appreciation for that. But I personally and professionally could not see a convincing argument of one position over another to really make a solution. I mean, it's a problem that people got swept up in.
Well, we'll disagree to disagree when the vast majority of states did something else.
Okay.
You're finished, Commissioner?
Yes,
Thank you. Commissioner Sabatini, please.
Thank you, Chair. I looked at the plan, and you had a grant in there for a refugee. Can you talk a little bit about that and what that is specifically about?
Yeah, it's a grant that's passed it's federal funds that come to the state as refugee assistance. They pass the dollars to us, the portion that's targeted to older adults. And for that, we've targeted the Middle Eastern populations. We have a contract with, used to be called the Ladies of Charity, Chaldean Ladies of Charity. I forget their new name. It's like Community Health or something now. And they do a lot of programming and outreach for older Chaldean and Middle Eastern residents in terms of socialization, assistance with things like immigration, not say challenges, but issues, English classes for the non-English speaking to learn English, things like that, trying to help them adopt and thrive to the best possible in this kind of an environment that's new to them. And it's a sole contract, and we're essentially pass the dollars through to them, and probably have done it for maybe 4 or 5 years now.
Okay. Thank you for the explanation. Thank you, Chair.
Commissioner Van Sickle?
Thank you, Chair. Good afternoon. As a follow-on to Commissioner Sabatini's question, you mentioned that you have a subcontract out with a group. How do you monitor that subcontract to know that there's performance?
With all of our contracts, whether it's like Macomb Community Action or in this case, this organization, we have reporting requirements that they have to provide to us in terms of their activities, their numbers of people served, units of service provided, and then we have we have 2 assessments that we have of our subcontractors. One is a fiscal assessment where we look at the finances and where the dollars spent in accordance with the budget that they presented in their agreement with us, and then looking at if they have client files, looking at files to see that people were served as directed. They have sign-in sheets to their events. If they say they had 20 people coming to an educational event or an ESL class, did they show us a sign-in sheet that has 20 names on it that looks like it? So those are the 2 mechanisms.
Do you do any random surprise visits to verify that the reports are actually accurate, let's say?
No, we don't do surprise visits, but we have a close working relationship where they do activities, we may be a part of that, or they invite us in, or we have them come in and do presentations, what they do, like we've had them do like a PowerPoint presentation with their activities that shows pictures and things like that, but we don't do surprise visits.
Thank you. Thank you, Chair.
Commissioner Kraft?
Thank you, Madam Chair. I want to piggyback off of Commissioner Farrington real quick. In terms of advocacy before the pandemic, what types of advocacy did AAA1B do? Did you advocate, besides to the County Board of Commissioners, obviously you come to us every year, is it state, federal, who do you talk to, and what have you said in the past?
It's primarily state, federal, and county. We try to look at the things that are the most urgent issues in terms of our population, and the biggest thing for us is we have over 1,000 people on the waiting list for in-home services through care aids like personal care, homemaking, and respite. We look for opportunities, so like if there's a legislative proposal, we pay attention to that and provide feedback, either pro or support, and do some analysis of that. And then there are other educational things. We're talking to a number of our counties about addressing wait lists and services, and most of the counties in Michigan, for example, have senior millages, so that's one potential strategy that people can consider, so we educate in that way. And then we develop an advocacy legislative platform every year that lays out our policy initiatives that we support, and we use that it comes with board approval, and then that becomes the main focus of the things that we advocate and the positions that we take. And then we try to just be responsive to when things pop up as well that aren't unanticipated.
Thank you.
Our goal is to be a data-driven organization and to provide information on what we know about the issues and the concerns, the need to decision makers, so that you have the ability to make as informed a decision as possible.
So I thought I was done, but so I work for a state representative. I know how difficult it was during the pandemic to work with the House and the Senate, and it was very much so from the executive branch of government that was running a lot of things and making a lot of decisions. Whatever your stance is on that's not the point, but in terms of advocacy, that would have been the person or the branch to go after and advocate to. How much advocacy did AAA1B put in towards the executive branch of government during this time?
Just in relation to the nursing home issue or other issues in general?
In total.
Well, it was more related to other issues, like we were demanding the flexibility, demanding the ability to continue services or start new services for people without doing that face-to-face assessment if we felt we could do it over, on the phone. I mean, we were fighting with the state over the chore issue that Commissioner Mattis said. We've been doing grass cutting and snow removal in this county for like 40 years, and all of a sudden they said, now their interpretation of service definition is chore or grass cutting can't be done on a regular basis. So we have, for the most part, we have a good, strong working relationship with our state office, but we have differences of opinion, and we're not shy or afraid to tell them what we think, and if we have a different opinion.
Thank you. I just kind of wanted to understand the scope in the past, 18 months, because it has been a challenge. So thank you, Madam Chair.
And if I could just piggyback for Commissioner Matuzak, because we've had,
The microphone.
oh, sorry. We've had conversations regarding the concerns that were raised. The one area that, as I'm standing here, I could think of that might have changed, because I am new to this role, I'm not making that as an excuse, but my knowledge is more limited, would be the RFP cycle that would have been before me taking over, and what that read versus what our RFP cycle states now. But I know what the service standard state now, so that's one area that I'd like to explore and get back to you on, as far as that might be a difference.
Thank you. Madam Chair, I have another question, but I can't request to speak again because I'm still on the list from the first time.
Why don't you go now, Commissioner?
The Area Agency on Aging's primary role is not advocacy. The primary role is receiving funds and spreading those funds out to other organizations like here in the county, as well as other people that provide direct service. You do provide some amount of direct service, but for the most part, you're receiving money from the federal government, from the state government, you're finding other grants, and you're sending that money out. That's your primary responsibility. Your primary responsibility is not as an advocacy or lobby group. Is that yes or no?
Yes and no.
Okay.
To most people, that is far and away the most important thing we do. Our Federal Older Americans Act, we have 4 mandated responsibilities. Planning for the needs of services, which is needs assessments and determining how to use the dollars. Advocacy is the second. The allocation of the dollars is the third. And then coordination of our allocation efforts. Don't go out using our money to duplicate what's in our region already. Those are we always think of it as 4 major responsibilities.
Thank you.
But you're right, that's only 25% for advocacy.
Yeah. Thank you, Madam Chair.
Commissioner Brown?
Thank you, Madam Chairwoman. Mr. McGuire, good to see you today. Commissioner Matuzak brought up a good point about dividing out how much advocacy plays versus the other roles that you have. Because actually, if you take a critical role on an administration that's doing something that's detrimental to seniors and they disagree with it, that could probably impact your funding, couldn't it?
Not as long as I don't think so, as long as we conduct ourselves professionally. There have been many times when we've had significant disagreements with the administration, and sometimes we've rallied our counties to support us over the years. I don't fear repercussions, significant repercussions.
What's the, is there how would you arrive at an advocacy, how do you arrive at an advocacy point? We're approving your plan, as we've done many plans before, and I've been involved in this process for many years.
Yeah.
How do you go about saying this is what we're going to advocate for? Is that your AAA board, your total board decides to take a position on something and say, we're going to say, we don't want the people locked in nursing homes or whatever the topic happens to be, and they vote on it, and then they give marching orders to who to advocate for you? Can you explain that process?
Well, like, if it's simple, a piece of legislation is easy because it's a written proposal. So we analyze it from the perspective of what's its impact on older adults in the region and other related stakeholders. And we try to figure out what is the position is in the best interest of older adults, whether we like it or not. What do we think is the best for seniors? And then once we arrive at that, we talk it over with our board and advisory council. We make a recommendation, a written proposal with a recommendation, and our board and council takes action on whether or not they support or oppose that legislation or that position. And then if they support it, then we would send letters or have conversations with, if it's state legislators or county commissioners or federal officials, depending on who's the entity that would impact the issue. It's kind of a pretty common process from our perspective.
Sure, I understand that. You can understand there's a lot of frustration because a lot of people are looking for, accountability after this pandemic's one, and there's a lot of fault to go around, right? I mean, who controls the purse strings is one people to look at, and who has the money. Here primarily, though, as Commissioner Matuzak said, a pass-through agency that's advocating dollars and spreading money down to do things in our county, and advocacy is a percentage of it. You do a variety of things. There's so much good that comes as a result of the money that AAA has done for so many people throughout the county. There's bound, because you're involved in so many, what's the total budget? I forgot my first question, I have it back. What's the total value of this plan?
It's about $23 million.
Okay. And what percentage of that goes to Macomb County?
Well, about $5.5 million, to do the math. About 20%, I'd be 19%. I think you're about 19% of our region's senior population.
Yeah, that's what I recall. The changes that you made in the plan since it was presented to us last time, what was there any significant dollar changes in the value of the plan, or was that basically a zero-sum game, just moving the 23 million to one spot versus another spot?
No, it didn't, it wasn't, not a financial impact at all. It's just going to be something on Maggie's list of things to do to pull together the providers and review these standards and come up, take our recommendations and feed them up to the state. So it's just business as usual for us.
When Commissioner Matusek says they went through the plan with a fine-tooth comb, I believe that would be a long meeting, Commissioner, and I appreciate the work.
Started an hour early than we usually did.
Yeah. Well, I appreciate your service on that. There's a lot there. As you can see from this plan, there's a lot of moving parts. We all wish that things would have been different during the pandemic, and wish the administration didn't do certain things. We all probably could have done better to maybe make a better case to get them to change their view. And maybe you should have taken a position to do that. Maybe you did. I'm not sure, but the AAA funding and the money that comes to our community, ultimately to our constituency, is very key for so many areas. The chore funding last year, you recall, this board stepped up and put in $250,000 to plug a hole in the budget that somehow was left out. But we took care of our county residents because we thought it was important. We're looking forward to resuming that now that in this next budget. So there's a whole host of issues here that this group gets involved in that some of us may have personal issues with because we think, well, that's maybe not the right way to spend the money. But overall, the money generally gets to the people that need it and is good. And because we have a representative now on the board there that is our advocate, we can pay perhaps closer attention going forward on issues that we particularly care about, whether it's immigration, how they're managing programs, or accountability. Accountability is key in government. We're spending a lot of money, and our job as commissioners to make sure we approve the contracts, but ultimately the buck stops with us. Accountability, if something goes off track, well, they're going to ask us, well, how did you not know that this program wasn't working as well as you represented it to be? And so there hasn't been any big issues that we've occurred through the AAA board in the years. And yes, this board's had disagreements with you in the past on you being speaking collectively. You have long experience in this and your job there, but we've had some knockdown, drag out things and things that we've disagreed. I've personally disagreed with, but generally speaking, it's been it's a positive program, and I'm glad to know that the commissioners are paying attention to what's going on and encourage them to continue to ask questions, critical questions, because that's where we get the answers, and that's ultimately how things are improved, especially on accountability. So, thank you, and thank you, Madam Chairwoman.
Can I respond? I want to take your comments to heart on the issues and concerns of Commissioner Farrington. I'm not saying we're infallible. Maybe we did not judge things appropriately in our analysis early in the pandemic. We're not infallible, and I recognize that, and I appreciate being held accountable, and I'll be more. I appreciate the fact that you're just concerned about it, our advocacy, all our other things, and we'll keep that in as a lesson as we go forward.
Thank you. Thank you, Madam Chairwoman.
Commissioner Kraft?
Thank you, Madam Chair. Last question, I promise. We have a lot of new commissioners. So what is the consequence for Macomb County if the resolution is not passed?
When we take our plan to the full state, they want to know, we have to report whether or not all of our counties have voted in support of the plan or not supported the plan or taken no action. So it would be noted by the state that there was, and they would want to know the reason why the board did not approve the plan. And they would factor that into their approval process. We've never had a county not approve the plan. We've had Washington County for a couple of years didn't take it to action or didn't schedule it. And we've had a couple of times when the counties have wanted to hold our feet to the fire on a few issues before they would grant that approval. And that was usually done in the committee process. But that's experience.
Thank you. Thank you, Madam Chair. I'm done now, really.
Commissioner Van Sickle?
Thank you, Chair. Advocacy is generally, I believe, people generally think of that as partitioning policymakers and trying to get them to either change policy or to give you more money. I would suggest the flip side of the more money is to an advocacy for our agent and your clients is to also make sure that we're getting the most out of the dollars that you're passing through. Because if we can help more people or help people better with the current funding, I think that's also important. I guess I'd like to see a little more aggressive follow-up. Let the organizations who get money know that we're watching, because I don't have any particular organization in mind, but you know how people are. Things get sloppy sometimes. So I'd like to see a little bit more focus on monitoring the funds we already have in play. Thank you. Thank you, Chair.
Thank you.
I believe we're now ready for a vote, please. Thank you very much.
The motion passes 10-1 with Commissioner Farrington voting no.
Thank you very much.
Thank you.
Thank you for all you do.
Thank you very much.
We're now going to 7C. Can I have a motion to move to full board?
Motion by Nard.
Chair, this is Wade.
And we're going to have, Brian isn't here. He doesn't have.
I'm here for Brian.
Oh, thank you.
Madam Chair?
With no hair, I look like Brian, but I'm not Brian.
Oh, thank you.
I'm not as big either.
Yeah, Madam Chair?
Or big and.
Can I have a clarification on this motion?
Yeah.
Is this a full board vote?
I have a full board approval.
All right, I just
Motion
want
Yeah, it's not, if I may, it's not to move it, because it came out of my committee, it's not to move it to full board, it is approval of the full board.
It's approval.
Yeah, whoever made the motion needs to restate
Oh, I'm
it.
sorry. I did make the motion, so. Your chair.
Made this
So-
motion.
Oh,
Oh,
then it's a
who
motion
supported it?
You need to make
should
a
we
motion to
waive?
approve it, just to approve.
for the full board approval.
Okay, motion to approve.
Support Farrington.
Thank you. Stop doing this. Yes, go
Yeah,
ahead, please, thank you.
related to this project is, we get annual funds from the state. This is not part of those annual funds. This is a grant process for improving roads in areas where manufacturing is coming in. We had manufacturing coming in down on DeQuinder, just south of 10 Mile. It's a company that makes a part for General Motors, three shifts. Because of that, we received this grant to redo that entire mile of road. And with the combination of the grant and the combination of the company's money that they put in, this project is only costing us $200,000. So it's a very good way of redoing the road for cost effectiveness.
Thank you. Chair Brown, do you have something to say? Must be from before. Commissioner Farrington?
Thank you, Madam Chairman. Just a question, because I'm getting confused. It seems like every week in my committee, there's something for that segment of road on Mound Road. Why was this not part of all the other ones that we've been doing?
This is DeQuinder. I'm sorry. If I said Mound, that
Okay,
that
we've
was
had about
mistaken.
3 on DeQuinder as well. Why has this not been part of the DeQuinder ones?
There were 3 agreements that had to be made for this.
All separately? They had to be separate, though?
They had to be separate. It's a state requirement.
Thank you.
So,
Can we take a vote, please?
The motion passes 12-0.
Thank you very much. Thank you very much. We're good.
I've got D2 as well.
Oh, I'm sorry. Do you want to just take that?
Yeah.
Madam
I'm
Chairman,
sorry.
I'd like to make a
Hello?
motion
Thank
to
you.
have full board report this out.
Okay, this is an approval of another grant that we received for a Bruce Township trail. Trail money is competitive from the state. We're very successful at getting trail money for different communities, and this particular one goes to Bruce Township. The project is along Old Van Dyke, up around 33 Mile Road. So it connects one of their parks down to their municipal center.
Should we take a vote?
The motion passes 12-0.
Thank you very much.
Thank you.
We're on to new business. Does anyone have anything for new business? Commissioner Romano.
Thank you. If I may, Commissioners, I just really wanted to give a shout out for Commissioner Candace Miller. Very fortunate in Sterling Heights, we had no flooding that I heard of, but I understand some of my commissioners had some problems in their municipalities, East Point, Warren, Centerline, which could have been, believe me, much more worse than it was, or much worse than it was. But because of the Chapelton overflow that we have, some of that stuff that comes out used to be just discharged, raw sewage in the Lake St. Clair. Through the efforts of Commissioner Miller and her staff, now they have that's most of that being treated at the Detroit plant before it's discharged into Lake St. Clair. So through her personal efforts and the personal efforts of her staff, I know the flooding wasn't good, but believe me, when it could have been much worse, and I just wanted to give her a shout out for a great job. Thank you, Commissioner.
Thank you very much, Commissioner Romano. That was a great video that she had. Any other new business? We are now going to, I'm sorry. Did someone else?
I think I hit the button 3 times.
I'm sorry, I must miss it. Oh, yes, Commissioner Haw.
Thank you, Madam Chair. I don't know if you've had the opportunity to see Candace Miller's latest video where she put out demanding an investigation of Wayne County down in Connor Creek. I think that's something we can support wholeheartedly with the flooding and the mismanagement, according to Candace, that took place down there, which caused a lot of the flooding and sewer overflow. But I wasn't going to speak to that, but Joe raised the issue. I just wanted to say, welcome back, Commissioner Romano. It's a pleasure to see you back here. And wish all my colleagues a safe and happy 4th of July. Thank you, Madam Chair.
Yes, thank you. Commissioner Matusek?
Along the line of the flooding, I wanted to take a minute to recognize the actions of 3 police officers in Clinton Township, Ryan Dittmer, Gino Ballone, and Richard Pfeiffer, who literally saved an elderly woman whose car had been pushed off the road by water, and the car filled up with water, and they saw the situation and jumped in and rescued her. She turned out fine. The officers were safe, and I just think it's a remarkable act that they performed and deserving of recognition. Thank you.
Thank you. Commissioner Song?
Thank you, Chair. Respect, kindness, and professionalism. All these things do not cost a penny. And let me just remind all of us, as I share this with all of you guys, I received a very angry phone call from the county executive this Tuesday. He used very loud tone and bullying language. He was cursing, he was yelling. He was not happy that I raised a question last Thursday about the CARES Fund and the statement I made in the Macomb Daily. Of $70 million allocated to business grants, only $39 million was actually provided to small businesses, and the remaining $31 million was used elsewhere. My small business, Mine Co., located on 12 Mile in Warren, received a $5,000 grant that was administered by the county last July, and that went towards rent because we were forced to shut down beginning in March, and our landlord required us to continue paying for our rent. And at October, my business received $2,174 from the Workplace Safety Grant in order for my business to operate safely for our customers and staff. This was all before I was elected to office. I know how critical these funds were to keeping my business stay afloat and paying my employees while I took a pay cut. I wish that other businesses had the same opportunity to apply for these grants. And in January, I shared publicly with all of you during full board that I abstained from voting with regard to any grants because my company did apply for the grant. What I didn't tell you was that I actually went door to door to businesses in Warren and Centerline, sharing with them about the same grant, and that I translated as best as I could for those who couldn't speak or read in English. There are those who are so busy working in the back of their restaurant or serving customers that they didn't even know that there was a grant. The state advertised that businesses shut down completely during the second executive order could apply and receive up to $20,000 if they were shut down completely, or $15,000 if they were partially closed. Macomb County only gave out $5,000 per business. It didn't matter how many employees each one had. Of course, 7,000 to 8,000 grants were awarded in the county, but we have over 19,000 registered businesses in this county. And if you're wondering, my company was not awarded for whatever reason. So what this tells me as a business owner is that if you have a business in Macomb County, you will get less support from the government. While other businesses who choose to open up their business in other counties will receive more support, because counties across Michigan receive the maximum $15,000 and $20,000, with Oakland awarding $7,500. And so $20,000 or $10,000 or $7,000 might seem a lot, or maybe not enough. For some business owners, this is their only lifeline during a pandemic. And if he wants to talk about 1 in 9 residents in Macomb County is a minority or foreign born, and every day people move to Macomb County because it's a welcoming county, I believe that. But you do not get to take credit for that. And I hope that he doesn't speak to his staff or any of you the way that he spoke to me, and to call and raise his voice at you, because we are the legislative oversight branch of the government. We do not answer to him. It's not our job to make him happy, and I'm going to continue to speak my mind, because this is not going to deter me. I just wanted to share that with all of you. Thank you.
Thank you, Commissioner. Commissioner Nard?
I just wanted to solicit everybody's thoughts, good thoughts and prayers for the family who lost their 5-year-old son on, not yesterday, but Tuesday at 9:45. They were crossing the street at Van Dyke and Stevens, and a young man running down the bike lane and blew the light and hit him and killed him in front of his sisters and cousins and mother and father and aunt. So they are really in need of our prayers, and if there's anything anybody can do, I've been in touch with the detectives that's on the case. They did arraign the guy today, thank God. And and I also want to just request prayers for the young man too. He was 22 years old. He said that he was on his way to work. He was running late, got a new job at Chrysler, and he was in fear of losing his job. But that doesn't excuse you running the red light. He said he was intending to run the light to get to work on time, but he didn't see the little boy. Okay, so just with that, just keep your thoughts and prayers for this family, because they're going to need it in the next coming days. And if there's any other information that I get from them, I'm going to be speaking with them tonight. I will share with the commission.
Thank you, Commissioner. We are now going to go to public participation. For those of you who want to speak, you have a maximum of 3 minutes. Thank you very much.
I'd like to speak, thank you.
Yes.
Madam Chairman, ladies and gentlemen of the board, my name is Timothy Barkovic. I am a taxpayer in this county and reside at 39801 South Point Boulevard in Harrison Township. I appreciate the opportunity to address the board. My concerns are these, ladies and gentlemen. As some of you will recall, because you were seated on this board appropriated funds to the CPA firm of Yo and Yo to conduct a forensic audit of 4 or more secret bank accounts that were maintained by Eric Smith and his office. And as some of you probably are aware, or all of you are aware, it was alleged that Mr. Smith and possibly others in the prosecutor's office stole probably over $1 million of taxpayers' funds and embezzled these funds from the county. Now, members of the board, I am advised by Corporation Counsel that the report, the forensic audit from Yo and Yo is completed, done, and prepared. And this board is the client of Yo and Yo. And I have tried to get my hands on the report of Yo and Yo to find out exactly where this $1 million plus went. And it's important to find out at the earliest possible date, not only for my personal benefit and just to know how much money Mr. Smith and his cronies stole, but it's also important to find out for the reason that Corporation Counsel can institute litigation against those people who Eric Smith gave the money to and possessed the money wrongfully. And there's a statute of limitations. Being a former member of the state bar and now retired, I can tell the board that there's a statute of limitations that must be honored in terms of allowing the Corporation Counsel to go after these people. Now, first of all, I'd like to ask, and I don't know who to direct my question to, is where is this report, and why, as a taxpayer in this county, can't I get a copy of this report? And I direct that...
Per our board policy, we're prohibited from having interaction with members of the public during public comment. This is your time to speak.
Okay. No, I want an answer, Mr. Brown. Tell me.
I just told you.
Okay. So you're refusing to answer my question?
We're not, you got a reason, we're not allowed to have a debate with you in a public comment, period.
Well, by a show of hands, how many members of the board want an answer to this question?
Point of order, I think the question was answered by the board chair. Would you continue,
No,
sir?
Sir, he refused to answer my question.
I told you what the board policy is regarding public participation. Same we tell everybody in the members of the public. Out of respect, this is your time to speak without interference from the board or debate from us. So you can choose to continue your speaking, or you can...
Okay, will someone give me an answer? Yes or no? The answer is no, right? The answer is no, right, Mr. Brown? Is the answer no? How come a citizen of this county can't get an answer from his county board or the elected officials in this county? How come?
Mr. Barovic, we don't respond at this time. This is your time to talk.
Well, who's going to answer my question? Who's going to get a copy of this report so the citizens of this county can determine where the $1 million plus went? I'd like to know. But no one will give me an answer. No one will give me an answer. And since this board is the client of Yo and Yo, you can demand and respectfully request of them to provide me with a copy of that report, or you with a copy of the report, or all of you with a copy of the report, because, you know, we've been talking today, I think Commissioner Zong said oversight is your primary responsibility. Mr. Brown, you said accountability is your primary responsibility. What I'm asking for is oversight and accountability and answers.
I think you could give us your email, and maybe we can...
Point of order. You're not allowed to speak to members of the public when they're speaking. That's the rule.
Mr. Barovic, I'm sorry. You have to stop. The time is up now.
Okay, hold on. I've got something else to raise to the board. May I have an extension?
Mr. Barovic, I'm
Judge,
sorry.
excuse me. Board members, I have a right under the Second Amendment to seek redress of the government for my grievances, and 5 minutes is not sufficient. I have a second point I'd like to raise.
Mr. Barovic, I'm sorry.
The answer is no.
The answer is no, I'm sorry.
Okay. I'd just like to know when I can get a copy of this report, and when we're going to have answers, oversight.
Order, Madam Chairman, let's move the meeting along.
And accountability. You can bang your gavel down. You don't have to do that. I'll respectfully leave, and I thank the members of the board. But I'm telling you, okay, I think that...
Thank you, Mr. Barovic.
I am telling you, as members of the board, that you owe it to the citizens of this county to get a copy of that report so that we can see where
Number
our $1
10
million
is adjournment.
went.
Moved by Romano for adjournment.
Support Farrington.
Roll me out.
Please vote.
The motion passes 12-0.
Everyone have a great 4th of July. Enjoy yourselves, be safe, have fun, and we'll see you all back here on the other side. Thanks.